get started, for people who I don't know, I'm Rob McConnell. I'm a professor in the Department of Population and Public Health Sciences and the director of the Children's Environmental Health Center here that sponsors the Be Heard webinar series. This series is designed to promote new skills for academia to engage the world, particularly the world of environmental health. We started with training and working with the press for when you all who are academics get your 15 minutes of fame. And as time has gone on, that inspired us to think about other ways to have our message be heard. And we've focused in particular on how to engage with community organizations and civil society, where the science really can translate to policy in a more effective way, and where we can be part of it as well as partners. This particular webinar, I think, is important for the doctoral and postdoctoral trainees and perhaps others, because it provides an example of an alternative science career. Erick and Anna both have a background in science or policy, and are doing really exciting work, as you'll see. I'm going to turn the session now over to Max Aung, who's an assistant professor also in our department, who knows a lot more about science communication than I do, to moderate the session. So Max, take it away.
Thanks, Rob. Hi, everyone. I'm really excited to moderate this session today. So I will just sort of give, like a staging of, what we'll sort of talk about today. So the theme of the webinar is going to be focused on this intersection between policy advocacy and community partnerships. And particularly, our panelists are going to share with us their experiences with addressing the problem of PFAS drinking water contamination and monitoring. So for those of you who might be unfamiliar, PFAS are called per and polyfluoroalkyl substances, and they are persistent organic pollutants that have been manufactured for decades and incorporated into several consumer products, including non-stick cookware, food containers, and they've also been used in firefighting foam. So because of this widespread industrial manufacturing and waste management, these chemicals have contaminated various ecosystems across the US, and drinking water being one of the major sources of human exposure. And these chemicals are important because we know that there's widespread detection in humans, and they've been linked to various chronic health conditions, including cancer, liver disease, and metabolic disorders. So I'm excited to moderate the session with our panelists, Anna Reade from NRDC, and Erick Orellana from Community Water Center. And I'll start with first introducing how I met Anna, and then I'll hand it off to Anna to introduce how she's met and worked with Erick. So Anna Reade is a senior scientist at the Natural Resources Defense Council, and I met Anna through reading one of the really great scientific reports that her and her colleagues published. It was titled Dirty Water Report, and it was focused on the PFAS drinking water contamination issue in California specifically. And our team of scientists at USC were very interested in this report because it informs a lot of the work that we do. And so we engaged Anna early on, and also her team members, to learn about the insight and knowledge that they had on the current scale and magnitude of the PFAS contamination problem in California. And through these meetings, we were able to learn from Anna and her team's expertise and really focus our research questions for addressing PFAS exposure assessment and biomonitoring in LA County, particularly to address this issue in historically marginalized communities, and also think of some of the major data gaps that researchers can fill with their work. So with that, Anna, I'll hand it off to you to introduce Erick.
Thanks, Max. Yeah, so I'm a scientist with NRDC, and I lead our PFAS work for the organization. And so I do a lot of work, internationally, federally, but also at the state level, and particularly like to spend a lot of time in California working on PFAS for lots of reasons. One, I live here. And two, there's a lot of really powerful things we can do in this space in California. But again, California is kind of near and dear to my heart. And as I started to work on PFAS policy in California, I connected with another organization called Clean Water Action, and we started to talk about the fact that California likely has a lot of PFAS contamination in our water, even though nobody was talking about it, 5 or 6 years ago, and nobody was really thinking about it because we don't have a big smoking gun. We don't have Chemours or DuPont or one of these larger facilities that produces PFAS. But we'd seen all these reports about contamination coming from DoD sites and airports and all these kind of industrial facilities as well. And we were like, California has a lot of those. And so what we started to do was start to reach out to other communities, members, to other organizations, and that's how I first started. I learned about Community Water Center, who is an organization, a community-based organization that does fantastic work towards basically fighting for the right for safe and affordable drinking water for all Californians, but really focused on the communities in the Central Valley that have some of the worst drinking water in California. But our earnest work didn't really start until we got some attention on PFAS in California, and the water board started to actually monitor for PFAS in drinking water and in source water around possible contamination facilities. So they started to look for PFAS contamination around airports and around oil and gas facilities and all these places that we suspected there would be contamination. And when the first round of, I think about the first year of data started to come out, we took a look at the state map. And if you're from California, you would also probably have the same reaction. Started to see hits all along Central Valley and in Southern California and in parts of the Bay Area. And these are already where we know there are other types of drinking water issues and water concerns. And that's what started our work on the Dirty Water Report. And that's when we started to contact and work with Community Water Center and Physicians for Social Responsibility in LA, because, one, we wanted to understand better what it meant for communities to have PFAS contamination in the drinking water. But we also knew that the people that understood this the most in some of these most impacted communities are the community groups that work there. And so we've started this really wonderful collaboration with Community Water Center. And I have just had the privilege of working with Erick in that capacity. He is their senior policy advisor on this issue. And I think Erick and I can talk a little bit about our journey with the drinking water work with dirty water from here. But I just thought maybe, I don't know if Erick, you wanted to say anything, but basically, I think that the Community Water Center has just done a fantastic work in the Central Valley towards awareness and advocacy to get clean water for their communities in the Central Valley.
Thanks a lot, Anna. Really appreciate that introduction. I wanted to say thanks to Max and Rob for the opportunity to share a little bit about Community Water Center's work with you all. It's just a privilege to be able to share with you. But yeah, I'll just go ahead and share a little bit more about Community Water Center. So we're based in California, Central Valley and Central Coast, and we work with rural unincorporated communities, oftentimes relying on state small water systems or domestic wells. And they're really surrounded a lot by agriculture. And so a lot of the impacts that we see and that got us started in this work was nitrate contamination in drinking water. And we've expanded our advocacy to other contaminants that we've found and seen impact the health of our communities. And so we do a number of things. We focus on advocacy and organizing our communities to get involved in the decision-making process, We're also a technical assistance provider to the State Water Board. And so we help implement solutions for the communities that have been living with drinking water contamination or source water issues for decades, to be frank. And so we've done this work for more than 15 years, and just excited to continue this work. There's a lot of work that remains to be done, a lot of partnerships with groups like NRDC and experts in the science field like you all. And so just really looking to continue to do this really important work for us.
Thanks, Eric and Anna. So I do have some, prompt questions that I can help guide the conversation. And if others in the audience have questions, please raise your hand through the emojis and introduce yourself as you present your questions as well. So I guess let's start with, can you walk us through like one of the example collaborations that you two have worked on together? Walk us through like what ways scientists could contribute in your experience to the community concerns and needs. What were the challenges and successes of that type of work that you've done together?
I'll kick us off, and then it would be really good to talk a little bit about the monitoring effort that NRDC really supported communities with. And so as a community-based organization, PFAS is only one of the several contaminants that our communities are facing. And so it's also only one of the different portfolios of work that I cover. And so we have a limited capacity to focus on the latest data and science around PFAS. And so we really rely on experts like Anna and other partner organizations to help keep us informed about the developments in terms of the technology, really relying on them as the technical experts to relay this information to the communities that we work with. And so we have strong relationships with community members. We provide community pláticas, or community discussions, in which we talk about the issues that our communities are facing. We begin strategizing with community members about the potential solutions to those challenges. And so really just learning from each other and building on those relationships and knowledge that we both have has been a great process for us to share this knowledge and share the resources with our communities. And there's been a really good project that Anna helped lead for NRDC. It was a national project. And one of the challenges that we had in California and with the communities that we work with is while there was some monitoring being done by the State Water Board, there was still a lot of gaps in data access around PFAS presence in drinking water. And for a lot of the communities that we work with, particularly domestic well households, there still remains a lot of data gaps around just general water quality, let alone PFAS. And so we collaborated with NRDC on a project to help get us more data and information around what's in our drinking water in regards to PFAS. I guess I'll stop there and I'll let Anna jump in terms and talk a little bit more about the project, if that's okay.
Thank you.
Sure. Yeah, I think a lot of the work that we've done in partnership is to get more information on what communities are facing in terms of drinking water contamination. I'll actually just take a quick step back and say that it was our work with Community Water Center and the Dirty Water Report that basically showed that there's a lot of contamination throughout California, but that there was more contamination was more prevalent in communities that already had high levels of other environmental impacts. And so that report and that work helped us push for money in the state budget to support the Water Board in making sure that every state identified disadvantaged community was going to be tested. Their drinking water was going to be tested for PFAS. And that also they're working on ways to expand their testing for PFAS so that we're not kind of doing this, handful of PFAS at a time, but they're actually looking at methods to estimate total level of PFAS exposure in drinking water so that we can eventually just treat all PFAS in drinking water and get this stuff out of people's water for good. And so that, has been really instrumental in a kind of a great, like, in terms of showing partnership between, like, you don't have to just have one goal. You can have multiple goals in alignment, and so that we're making sure that the people that need this data the most are getting it, but also we're thinking long term about trying to make sure that we solve the problem as a whole. But following that, talking to both Community Water Center, who said, hey, we also have a bunch of other communities that aren't going to get this testing anyways because they're not on public water systems, right? And then also listening to a lot of other community members across the country who know they have PFAS contamination and their concerns about, hey, EPA is still only testing for 25, 29 PFAS total. And we're really concerned about the fact that we're hearing that there's a lot of other types of PFAS out there and a lot of other PFAS being, used and produced. And that's going to eventually end up in our environment. Like, we want to know more. We don't feel comfortable in this assurance that, that there isn't other types of PFAS in our water. And so around all these conversations, a commercial lab, a national commercial lab, published a test that would test for 70 different PFAS. So this is more than double what the EPA currently monitors. And from our conversations, both the Community Water Center and with other community groups across the country, we knew that this was something that they were really interested in. So we were able to lead a community-led study where we had people volunteer to test their water. And we coordinated all of that with the lab to test for 70 PFAS. And it was a fantastic experience. I taught a lot of community members how to test for their water on Zoom. And I also went out with another member of Community Water Center to the Central Valley, or no, it was Central Coast. And we tested water together, and then they were able, when they learned how to do that, they went and did the testing in Central Valley. And the results were, there wasn't any cross-contamination. Everybody did a fantastic job. Everybody was really great in terms of like timing and protocol. And when we got the data back, we really didn't know what we were going to get at all. This was all based off of their concerns. I mean, we shared them, but we really were doing this because this is what they felt was most valuable in terms of the type of exploration that we wanted to do. And they were right. We found, half the chemicals we found are not monitored by the EPA. And once we found that first initial round, we actually had funders that were interested in expanding the testing. And this is where I think I had a lot of, learning experiences along the way. Then you got to tell all the community members that you've worked with that we got to hold off on data if you want to get another round of testing in. It'll expand our study. It will help us in terms of messaging this issue. And then we could possibly also publish this in an academic journal. And everybody it was all about communication, making sure that people were like, okay, the bottom line is if we do get if we publish in an academic journal, that's going to be taken more seriously. We'll be able to use it better in our advocacy. And so we did another round. This project lasted like 2 years as we went back and forth through the pandemic. But eventually we were able to publish the study in an academic journal. And I think this is also kind of a little bit where it's helpful to have already built all these relationships with the community members, where we worked specifically with Community Water Center. We worked with them on how to report back data about how to develop talking points for their communities and the advocacy goals that they wanted to, and coordinated all of the publication of not just the journal, but of press releases and blogs and reactions and everything like that. So maybe Erick wants to talk a little bit about that process, but I think one of the best parts about doing this project was that I felt comfortable knowing that Community Water Center was there to help with reporting back the data and how to help us, with talking points and what was most important for them to communicate in the end.
Yeah, that's incredible. Thanks, Anna, for walking us through all of those great examples. Yeah, it would be great, Erick, if you could reflect a bit on that community report back process and what it was like for you, and perhaps educate some of us on some of the best practices that you've engaged in.
Thanks, Max. Yeah, I think sharing some of those water quality reports is some of the most difficult part of the work that we do. It's very easy when communities don't have any contaminants in their drinking water. But when there is, that's really the most challenging part, where we want to ensure that we respect the relationship that we've developed with community members. Really, sometimes we've held relationships with some community members for years, and then some community members were just recently getting engaged and want to continue to have them involved in our advocacy work and just continue to be engaged. And so sharing these results is really something we take seriously. And so we worked with Anna to, one, ensure that we're communicating the science and the data correctly. But we also worked with our community advocacy folks to ensure that we're communicating this information in a manner that's culturally competent, that addresses the fears and concerns of community members. And so with that in mind, we always want to ensure that we provide a next step or a potential solution for the communities who are impacted by drinking water. Want to inform them about the potential health risks that they could have been exposed to or could be exposed to if they continue to drink contaminated water. And so we go through all that. We try to give it the respect that such a significant conversation requires. And we talk to those members about what's the immediate next step. And so for a lot of community members, that's switching to a bottled water source. And so we connect with them. We do work with the State Water Board as a TA provider, and can, in many cases, we can work with them to get state-funded bottled water delivered to their households on a regular basis. And so we have that knowledge and awareness of the resources that are available. We can also talk to them about what are some potential point of use or point of entry devices they could use, or if there's a potential long-term project that they can participate in that's going on around their community, to not have to rely on filters or bottled water as a long-term source. So that's a little bit of what those conversations are like. There's really a lot of more dynamics at play depending on the community member that we're engaged and connected with. But it's something that we take very seriously. And I think it's something that we would really stress the importance of whenever we share some bad news, trying to at least provide some hope and solutions for what can be the next step for community members.
Thanks, Erick. So both of you have reflected quite a bit on direct sort of, solutions for affected communities. I was wondering if you could reflect a little bit about sort of the more macro policy translation side. Like you said, you've talked with State Water Board or other policy stakeholders. What's that experience been like for you? And, where do you see some levers of change in terms of, addressing this problem from a policy perspective?
Yeah, I mean, I can speak to it from kind of where my position requires me to be. So I think, my role is often kind of being at the kind of in between of a lot of different areas. So I spend a lot of time working with academics that work on PFAS and trying to give them a glimpse into the problems that we're facing from a policy perspective, and then also kind of what we're hearing from community members about what they're really, sometimes if you sit only in one seat, you don't see what everybody else is concerned about, right? So one of the important things to do is to have conversations with academics and policymakers and community members that are actually affected by the problem and try and understand what are all the connections that can be made to start furthering solutions. So a good example is like, I'll be in the middle of evaluating risk assessment being done by, say, the EPA and being like, oh, they have no data on this, this exposure route, and because nobody's studying it. Is that on purpose? Of course not. It's just not something that the academic community is aware that they need this particular type of data in order for the EPA to do X, Y, and Z. So that's like one example. Another example, is I think hearing from the community members. A good one is community members right now that have a lot of PFAS contamination that they're facing and have, say, found out that they've been drinking it for the last, 2 decades. What they really want to know is what that means. And they don't understand why there isn't more studies in communities that are being affected right now, right? And that's a really hard thing to address. So I think, for me, I sit kind of at this space where what I really love is to be able to make those connections and to be able to use science to help our policy goals. And I think also sometimes it helps me see where there are science gaps, right? So that's, I think, why we did that project, right? Is because there still is only EPA validated methods to cover 29 PFAS, and that's just not what people are interested in anymore. We know that those PFAS are in our water. We want to know what else is in our water. And when we did that study, the results helped us give context to a lot of the policy work we were doing. For example, when we were talking about the next round of national data testing, they're still only testing for those 29. So we gave context, we looked at our communities and we said, okay, you would be missing this much in your monitoring. But then we also were able to apply that to our comments for the national drinking water standards that are being proposed by the EPA right now. So we took our data and ran who would qualify for protections under these new proposed regulations. And there are communities that would be missed that have quite a bit of contamination. So communities in Texas have newer production of PFAS, and those types of PFAS are not picked up by EPA monitoring, and they're also not covered by the proposed drinking water standards. And so we found communities that, say, had 80 parts per trillion total PFAS that would not qualify for protections under the new proposed drinking water standards. So it gives us a chance to say, to provide the science behind us saying, you need to do more. You need to think about PFAS as a class. And we can say that, but when we actually have science to back it up, it means a lot more.
That's incredible. Thank you.
I'll share a little bit about the policy advocacy work that Community Water Center is engaged in as well. And so we are fairly new to the federal landscape of policy advocacy. We've been engaged in local and statewide advocacy here in California for quite some time. But I wanted to focus a little bit about the advocacy that community members were able to be engaged in during the development of the National Primary Drinking Water Regulation for PFAS. And there was a national PFAS roadmap that the EPA announced, and there was a number of engagement opportunities in that process. And one of them was the region listening sessions. And so as residents of California, we participated in the Region 9 listening session, and we had community members who have PFAS in their drinking water, or there's a lack of data around the presence of PFAS in their drinking water, talk to the decision makers around what their concerns are, the importance of advancing and establishing a regulation that's health protective for the communities. And I think probably there's I think one aspect of the work that's easier, or I think help is more accomplishable, more achievable, and then once that's a little bit more challenging. And so one of the things that we've seen the state or just governmental agencies more amenable to doing is providing some of the funding to address the drinking water contamination in the communities to provide the necessary investments. And so we've seen a lot of that with the bipartisan infrastructure law, provide some specific funding for communities impacted by PFAS. And so that's been something that we have been working with our communities to try to direct those resources to, and has been, I think, working in the past couple of years. It's been a really interesting and exciting time because there's been a lot of record investments that communities haven't been able to access in the past. It's a little bit of a different, we're in a different place now in the state of California based on some of the budget constraints. And so we've seen some of the PFAS funding be clawed back a little bit. And so that's unfortunate, but there's still a lot of funding available. And so that's been one of the key efforts that we've wanted to push and have seen states and the government more receptive to. The more challenging aspect of the advocacy work is trying to hold the polluters accountable to the contamination that they've caused. That is a significant challenge, one of the biggest mountains to get across, and just shows the importance of having community members who have been impacted by contamination, showing up in spaces, sharing their stories around how they've been impacted, and stressing for the importance of holding these folks accountable and making them be a part of the solution to address the impacts on communities. So that's a little bit of the work we've done. So that was the Region 9 listening session. We've also done some advocacy here in California, and just there's two of the different sort of efforts that are going on is providing that funding and addressing the polluters.
That's great. Thank you both for sharing about so many different dimensions of policy engagement and translation that you're both leading. And it's really, yeah, it's really inspiring to see how many different ways that we can translate the findings to help push policy forward. So I'm going to pause for a moment and see if anyone in the audience has any questions for our panelists. If you want to raise your hand. Any questions? Rob?
I'll start. So there are a number of junior investigators on the phone, Anna, postdocs from our group and other groups, and some of them are trying to decide, what they're going to do with their lives, and you've taken a path that's different from what most folks with a doctoral degree do. I wonder if you could tell us a little bit about how you decided to take the career path that you did.
Sure. So I think towards the end of grad school, I realized that I like science, but I like thinking about it on kind of a more macro scale. So I was looking for something different. I just was talking to a lot of people that I knew outside of academia, and ran across a friend who worked at NRDC at the time. And it sounded amazing. I didn't even know that you could be using, science for working on kind of tangible, immediate needs of people. And so I did an internship. I set up an internship with NRDC, and I was hooked within a couple of weeks. That's exactly what I was looking for, and I didn't know it existed a couple of weeks before. So I think for me, I was lucky in that I found an organization that had already had experience with bringing on scientists that weren't exactly an expert in whatever it is that they weren't wanting to work on, right? So I don't have any background in toxicology. My degree is in developmental biology. I studied zebrafish. And all of a sudden now I basically was able to self-teach myself toxicology and regulation and risk assessment. And of course, I had lots of help from my team. I work on a team of about half scientists and half lawyers because of the nature of working on chemicals. It's a rather technical area. So I could basically learned by doing. And so I've gotten to both do, basic like original science, like the community drinking water testing study, but then I also kind of do a lot of different things that keeps me, I think, really engaged and on my toes. And it's always kind of I feel like a learning experience all the time. But then with the undercurrent of always feeling like everything that I'm doing is for something that I'm passionate about. So that has kind of, it helps with all, whenever I hit a challenge that I was like, that's really outside of my comfort zone. It helps to realize why you're doing it. So I get to do all kinds of different levels of science, right? And communication. So everything from, talking to researchers to writing blogs or doing technical comments or, getting together scientists to address, really important issues that, for example, there are industry efforts right now to just kind of redefine what PFAS is. It's kind of this way of being like, I think my favorite, this was written by somebody else. I think it was a Union of Concerned Scientists. Somebody wrote a blog about this issue, and they said it was like being told you need to clean your room and deciding to cut it in half so that you didn't have to clean up half of your room and then just putting all your stuff in one side, right? This is the same idea. I just thought it was a very good analogy, but just the idea that, oh, well, okay, we'll just take out all fluoropolymers and all gases, and then the rest, you can look at the rest. And it basically carving out whole swaths of PFAS by just confusing people with what PFAS are definition-wise, right? And so we were able to recently pull together a scientist letter and send it out to all of our networks, and it has over 150 signatures on it. That's really like key in pushing back against some of these things, because if you think about a policymaker, they're covering everything, right? And so they're not going to get deep into the science of what a PFAS is or what it isn't and why a definition matters and who cares, right? But if they got a letter of 150 scientists saying, don't do this, it's really helpful. So like, I kind of think that that's kind of where I get to spend a lot of my time is at that, kind of addressing those pain points. So, yeah.
It's really exciting. Any PFAS researchers in the audience have
Yeah, I
questions?
can send you the link to
There's
sign
a
on.
lot of
Sorry.
Yeah, I think we have quite a few. Okay, so I guess, oh, Lita, you have a question?
Yeah, I always have a question for Anna. Thanks so much, Anna and Eric. Wonderful presentation and feedback. So for us who are working with communities, what will be your recommendation for answering questions on reporting back, especially if, we don't have the ability to test for all the PFAS that are available out there in the market. I mean, now we are learning about PFAS pesticides, PFAS active ingredients in pesticides, and PFAS like in agricultural settings. So what will be your advice or suggestion on this?
I mean, I can say something, but I think probably I'd point to Erick first in terms of responding to that. I generally, my experience has been that being as straightforward as possible and saying we know this, but we don't know that, but we are concerned about this is the best way to communicate. So yes, we have found out that there might be PFAS contamination in pesticides or being actively used in pesticides, and that's a big concern of ours. And we see that you have had pesticides used in your area, over X, Y, and Z is, it is concerning. And then again, as Erick said, it's always helpful if there's things that they can do, even if it's not directly related to, pesticide exposure, right? So, as Erick pointed out, how they can get access to clean water, how they can look for PFAS-free products, how they can, those kinds of things, maybe certain foods to avoid if they can. I think anything that helps them kind of feel like they have a little bit of control over reducing their PFAS exposures is not only good because they might actually reduce their PFAS exposures, but it gives them a handle on the problem. Erick, you should add.
I agree with all that, Anna, and I think when we first engaged communities around PFAS, they were unaware or just unsure about what PFAS was. And so a lot of that was just sharing information, educational resources around what PFAS is and what we were doing. And so we were very clear. We communicated to the communities that we're sampling for a subset of total PFAS. We explained to them some of the challenges that exist. We wanted to be clear to them that we're trying to give them as much information as is possible, but it's fairly. I think folks should feel very comfortable sharing some of the limitations that exist, and just being honest and upfront about that, and then just I think not denying that, but focusing really on what is possible and what information you can provide, so that they can be able to make better decisions around their health, around whatever potential exposures they might have. So that would be how I would approach a little bit of the situation.
Thank you. I think Connie has hand raised. Connie, do you want to ask your question?
Yes, hi, good morning. Thank you so much for having this. It's a pleasure meeting you. I'm a new postdoc here at the Environmental Health Lab with working with Joe Johnson and Brock McConnell. But I have a question in terms of working with communities. One of the things that I hear all the time is, I want to thank you for touching on that point about, being honest with the community about what you're seeing, the results, and what are your limitations. However, one of the things that I face is, I always ask, what do you do with the issues of sustainability? How do you keep the momentum going? How do you keep residents engaged? Because I feel that over time, people lose hope. They don't see changes fast enough. And I feel that it's something about, I don't know if it's lack of resources, lack of not seeing imminent change right away in their communities. And I know that it's, people just get tired. And so the question is, how do you how do you address that? How do you keep people once again engaged, or just making sure that they're on track, that they're constantly motivated to want to be present when needed to talk to elected officials and decision makers. Thank you.
That's a great question, Connie, and one that we wrestle with regularly. I'll share an example. One of the drinking water projects that we're working on, it doesn't have anything to do with PFAS, but it's around nitrate contamination. We've been working with this community for longer than we've been an organization, and so there's been a lot of fatigue, a lot of folks getting discouraged about the lack of progress. And so it is definitely a very real thing. I think one of the things that's important to do is to validate those feelings around the process and how long it takes and how challenging it is. But one of the things that we've done is to just remain engaged with the community. I think by continuing to develop those relationships, hold those relationships with communities, they can see your commitment to the issue, and see just your commitment to the community's concerns as well. And so just it's a very difficult thing to handle. Sometimes it means giving folks some space and re-engaging them after some time. So what we do is we're mindful of not continuing to ask the same community members with requests, being mindful of their time commitments, but then also continuing to be engaged. And perhaps we will re-engage them after they've had some time to take a break from some of the the process that is long, and oftentimes, as you said, it's very disencouraging.
Yeah, yeah, 100%. I think burnout is real. Not only just kind of in people who work on this stuff all the time, but as a community member, you have other things to do. And this is you have your own job that has nothing to do with this, and your kids and all these other responsibilities. And we're asking, extra like mental space and time and commitment and worry. We've seen that happen with community members that we've worked with before, where there's just a very understandable level of frustration that they, 5-10 years down the line of working on this, there hasn't been that much movement in some cases. In other cases, we have community members that have full water filtration systems, and like that community like has gotten to their goal, right? But in other cases, it's just more difficult politically, or and they've just, we've had them say I'm out, and I think, I've always thought about it as the same: give them a break, give them some space, and our response has been often, that's fine, that's totally understandable, validating those feelings, and then also being like, we're going to continue this work. If you want us to keep you updated, we can, and you can re-engage later, or you don't have to. If you just want to never hear from us again, that's fine too, right? But I think what's happened is like, I feel like you can kind of almost take up a little bit of that responsibility for them for a while, right? Like, you're just going to keep working on this, we've seen people come back into the space and continue to work with us. But I think our goal in the end is so that nobody ever has to think about this stuff, right? I mean, I know it seems rather idealistic, but people shouldn't have to know what a PFAS is. People shouldn't have to worry about the water, and they shouldn't have to worry about what they're buying in their, in the store. Like, all those things would be the end goal. So, yeah.
Thank you both for those reflections. Does anyone have any more questions? I guess I'll have one final parting question, which is, you've done a lot of great work together, and thinking forward, like, what are you enthusiastic about? Like, what are some future directions and things that you're hopeful for?
I'll jump in if that's okay. One of the things that I'm really excited for this year is to see a PFAS drinking water regulation be released by the EPA. But I'm also really excited about some of the sampling data that the communities will receive. And we're planning an effort to, once that data is released, share that information with our communities, talk to them about what that means for their households, and also work to draw down federal resources to make investments into their drinking water sources, so that they don't have to live with PFAS contaminated drinking water. So I'm excited about that sort of cloud of uncertainty being lifted from some of these communities, and working with them to take advantage of these investments. A lot of the communities that we work with haven't seen many investments into their communities. There's infrastructure that's decades old that is inadequate, and so being able to just take some of this funding that's available, infuse it into the communities that have needed it for decades, and live in a community that has safe and clean drinking water. So I'm really excited about beginning that process. It will be a long process, but excited to begin those conversations with community members.
Yeah, I share some of similar excitement. I mean, when the EPA proposed the drinking water standards for PFAS, that's the first time they've done anything like that in 6 years. So it was a big deal. And according, and not surprisingly, it's been stuck at the White House for longer than it should be. So are currently really working hard on providing the pressure that's needed to get them out and finalized. So I'm hopeful, but yeah, also a little bit apprehensive. And then I think the thing that I am really focusing on right now is as much as getting access to clean water is really important, there's no end of life solution for PFAS. And so one of the things that we're really focusing on this year is trying to just stop the additional use of PFAS when it's not necessary. I think, and we've worked on bills to ban the use of PFAS in various different individual product categories, and started to realize that once we started seeing reports out of like the EU on like there being, hundreds of different uses of PFAS across the economy, that's just not a way to really effectively reduce people's exposures and reduce PFAS use. Kind of even one category at a time. Even when you just take it out of textiles, still, I mean, it's a good thing, but it's not working on the scale that we need to address the problem. So right now we're working on a bill in California to ban all unnecessary uses of PFAS by 2030. That's a big lift. So maybe my excitement is a little bit of maybe I'm a little bit of a glutton for punishment, but that's what we're working on right now, and we're in conversations with groups that we have not had to work with before, that it's going to be more complicated. We're talking about electronics and medical devices and things like this. And it's not that we're trying to, stop people's ability to use PFAS if it's truly necessary, but we were trying to get rid of all of the uses we possibly can. So that's what we're embarking on this year in California. And it's going to take a lot of work.
Yeah, that's really exciting and very good news that you're working on that space and hopefully that it's successful. So, we're about at the hour, and I just wanted to thank you both, Anna and Erick, so much for taking the time out of your schedules to join this webinar and share your knowledge and insight with this audience. And I'll also add that Anna put in the chat the link to the sign-on. If you are a scientist and you want to sign on, please, check that out. And Rob, I'll hand it off to you if you have any parting remarks.
Thanks, Max. And thanks to Anna and Erica for this, or Anna and Erick for this session. If I were going to have a take-home message, it would be that, I appreciate a lot more how well you understand the research gaps relative to policy. And, for all of us in the audience, teaming up with folks like you is going to mean that we'll ask better questions, we'll have better aims for our research if we do so. I just put the flyer in the chat for the spring series. These are the second Tuesday of the month at 10 Pacific. And the next one is on the role of toxic torts. This is an unappreciated tool for policy. It's focused on, in this case, on a case study of an industry, of the asbestos industry, which we still worry about because it used to be in a lot of products, but lawyers and experts put the industry out of business. And I think if it hadn't been for them, we'd still be working through EPA trying to control new uses of asbestos. So that's a plug for the next session, and you'll see there's some other exciting ones that we're doing through June. And just one final comment is that if you have an idea for doing something, for making a bigger impact of your research, if you have a big paper and you want to do a press release for it, if you are interested in writing a commentary or an op-ed or a blog or doing a short video or an infographic, please let us know. We don't do all those things, but in the course of this, we've learned, we've met people. We know we have a good network of people who know how to do it, and we'd be pleased to help you make better connections. And finally, I'm putting in the chat the link to the International Society for Children's Health and Environment. It's some of the ISHE fellows are on this call. It's a great group that does policy related work in particular around children's health. So with that, we're right at the hour, and thank you all for coming, and I hope we see you in a month.
Bye, everyone.
Bye.